Thanks, Jeff. As Jeff said, I'm here to talk about my chaplain internship at University of Chicago Medical Center. It started with a visit to the career counselor at my alma mater. I was at a point where I wasn't sure where to go career-wise, and the career counselor brought up chaplaincy as a possible route. I've been fortunate enough to stay out of the hospital for the most part, so I didn't know lay Catholics were really that involved in chaplaincy. Ends up now the majority of Catholic chaplains are now lay people. So I applied and I got an internship at University of Chicago. And I had a positive experience. Whenever I did rounds, I always had at least one visit that was especially memorable and kind of reaffirmed that I was in the right place. And I'll share with you two of those visits that I had. One was with a middle-aged woman, we'll call her Claire, who had been in the hospital for 7 to 10 days. After making some small talk and praying together, she told me that she has 3 kids and that none of them came to visit her while she's been in the hospital. She discussed the care that she gave one of her kids when he was in the hospital, and that she was upset that the same type of care wasn't being given to her. I listened while she told me that she was clearly upset by this, but that she was going to forgive her kids for not visiting her. And I affirmed her by saying how much I admire her doing that. And as we talked throughout the visit, I recall her sadness evolving into a smile. I hope that I was able to fulfill a void for fellowship that she likely had. I later received word that another chaplain visited her, and she told that chaplain that she was thankful that I visited her. And I believe that during the visit, we were both ministers of God's grace. I went to Claire's room to serve, and I ended up being served. While the emotional and spiritual nourishment I believed that she received was probably a lot different from the emotional and spiritual nourishment that I received, I believe that while working to serve Claire's needs, that I too was being served by being given an opportunity to advance in love, and that I was given satisfaction knowing that I helped her. Another visit that I'll talk about is with an elderly female patient, we'll call her Martha, and she suffered a seizure and was with her family in the ICU. Martha had a tube sticking out of her throat, making her unable to talk, and she looked frail and uncomfortable. One of her sons told me that she'd been in the hospital for a month. And when I walked over to Martha, she immediately grabbed my hand, wanting me to hold her hand. She looked very scared, and I did my best to smile and to express sympathy while tucking my hand into hers. As Martha's family hovered around her bedside, she insisted that a son of hers hold her right hand while I continued to hold her left hand. And I find it flattering that she insisted that I be the one to hold her hand when she could have had her hand held by a number of her other family members. I think I ended up holding her hand for a little under an hour. In both of these visits, I was welcomed into a very vulnerable period in their lives. And it's an honor to have someone who knows you as a stranger to put their trust in you. I think both stories are an example of how chaplaincy in a hospital setting is a ministry of presence. And if I could summarize hospital chaplaincy in 3 words, it would be loving, listening, presence. I mean, anybody could sit and passively listen and hear every other word a person is saying. But to actively listen with love involves work. They want someone who will listen to them. I think that says a lot about the emotional needs of a hospital patient, of many hospital patients at least. I believe it's important not to overlook the emotional aspect of the human person when carrying out our duty to love and to heal the whole person. I also think the need hospital patients have for a loving listening presence says something about the emotional needs of many outside of a hospital setting who are in distress or pain. While working to put in my best effort to serve the needs of those in the hospital, it opened my eyes to the deficiencies I have in loving those outside of the hospital. Those people in my life outside of the hospital are just as deserving as the amount of energy I was putting in to serve the needs of the people in the hospital. Hospital chaplaincy is a ministry that involves discerning the needs of the patient and doing what you can to serve those needs with the eyes of faith permeating that encounter. I came to the realization of the challenge I have of bringing that ministry to those outside the hospital who I interact with on a daily basis. And I believe in ministering to those both inside and outside of the hospital. It's valuable to contemplate Matthew 25 and consider how grace-filled our encounters are with those who are considered the least of us. The passage in Matthew 25 that I'm referring to is whatever you did for one of the least brothers of mine, you did for me. In other words, the dying, the very old, the very sick, embody Christ. What we do for them, we do for Christ. With that understanding, the elderly are especially valuable. They have so much to offer us. They offer us a tremendous gift by embodying Christ. Old age is beautiful. The wrinkles of the elderly are battle scars of wisdom. In a culture where the sick and the old are given a TV remote and shuffled aside to wait and die, we must make it clear that they have immense value by treating them with respect inside and outside of a hospital setting. St. Paul says in Romans 12 that we should anticipate one another in showing honor. During the visit with Martha, I made sure to affirm her son that Martha is very fortunate to have a son that cares for her so much. Also, in Claire's case, I made sure to affirm her being willing to forgive her children. I believe, especially in a hospital setting, that it's important to give affirmation to fulfill an emotional need. Giving affirmation can help people rediscover or discover their worth as a person and the worth of what they do, which are both essential for an individual's health. But of course, we don't need to visit someone in a hospital or a nursing home to help fulfill someone's need for affirmation. You could do it right in your own workplace or home by telling your child that you love them, or telling one of your subordinates they're doing a good job. So much pain could be avoided if we would follow St. Paul's advice and more often tell our parents or our children that we love them. And I believe it says something about God's generosity, that He uses our seemingly small offerings, like an I love you, or lending a helping hand, or lending a listening ear, to do amazing things as an instrument of God's healing power. Both patients I prayed with were Protestant, Claire and Martha. And I want to point out how much of a blessing it is to have prayed with those of different faith traditions at the hospital. And I think it's important to recognize the beauty of ecumenical prayer. And it's also important to recognize that while there are real differences that separate us, what unites us is incomprehensibly stronger than what divides us. And perhaps many of you have had similar positive experiences of ecumenical prayer and dialogue and would agree that we should celebrate what unites us, that we could learn from one another, and we should build on common ground. We can take these positive ecumenical experiences and our desire for unity and channel it into prayer. Questions?
I don't have a question, but I understand what you are saying because I've been a hospital registered nurse for 50 years. And I could tell your story hundreds of times, but I've only worked in Catholic hospitals. So I've seen the Christian outpouring by everyone.
Yeah, thank you. And
also, we have a daughter who did have 8 children, but at one time she was pregnant with twins. At 6 months, she had a uterine infection. They took her to Lutheran General, and one baby was stillborn. The other one, I was in the operating room with her when they did a section, because they thought they could save the other infant. And I saw him wriggling and crying and screaming. These are wonderful feelings. But in less than 6 hours, he also passed away. And they brought her down to the nursery, and the only one on duty that night was a rabbi. And she said to him, "Sing with me over my baby." And he did.
Thank you very much for sharing that with us. Yes?
So, Brian, did you say you are actually changing careers? Is this something you're going to do full-time?
Currently, I'm teaching at Harper College. I teach in the philosophy department there. And it's going well, but I'm also currently working on a master's in order to get certified as a chaplain under the National Association of Catholic Chaplains. So that's currently what I'm working on.
And could you share with us what drew you to this work, do you think?
What drew me to this work? The thing with the vocation is, it could be looked at as a calling. It could be looked at as an invitation. It could be looked at as both. And I think I'm being invited to this vocation of chaplaincy. Am I being truly called to it? I think so. I believe that I've been given the spiritual gifts for that type of ministry. When I was being interviewed at University of Chicago Medical Center, I believe we were talking about spiritual gifts, about what I have to offer. And when I told them that, where am I going to get this patience, where am I going to get this type of compassion in order to be effective in this ministry, I told them that I think God used my parents a lot. That's where I think I've been able to get those gifts in order to carry out my ministry.
Well, from your talk, I think you do a wonderful job, and you actually got a lot of affirmation from that internship, which is so important. So I hope that you're around when I'm in the hospital. Any questions?
Yes.
You said that both Claire and Martha were non-Catholic.
Yes.
What kind of a prayer did you say with them?
I recall that I likely had a general theme of healing, a general theme of praying for peace. I tried to ask the patients or the family members who are in the room for prayer intentions, both because I think it's great that we could offer up these prayer intentions to God, and also because I want to make it clear that their interests, that their intentions truly matter.
Do you think your college training helps you to, discern a good prayer to say?
I think, yes, my college training has helped me. I think that by discerning the needs of the individuals in the room, I think that helps with what I should pray for. Well, like I said, I met with the career counselor, and I had a bachelor's degree in theology, a bachelor's degree in philosophy, and a master's in philosophy. So I had a lot of education and wasn't thinking I'd go back to school, but ended up I tried this internship, and I thought perhaps this is where I'm being invited. Perhaps this is where I'm being called, and that involves more education. I'm currently working towards a master's degree through Franciscan University of Steubenville Distance Learning, and having a good experience with that. And there's one more thing, I wasn't in my speech, but you mentioned about being at a hospital in a secular setting, and it made me want to bring up that I don't see how someone could not be a person of faith and work in a hospital setting. I mean, not being a person of faith, you're just surrounded by suffering, by death, without any real objective purpose for it. I don't see how anyone could do that from 9 to 5 and then just go home. I believe that you have to be a person of faith in order to truly find this work meaningful in a way that you're truly contributing to human flourishing. Only through the eyes of faith can we say, as Peter says in his first letter, that we could rejoice in sharing in the sufferings of Christ. To find grace in suffering, to find grace even in death.